Thank you, Mr Deputy Speaker. Access to dentists in North West Norfolk, particularly for children, was one of the issues I raised in my maiden speech when I reported that constituents were being advised to register in Skegness. That remains, as I said at the time, good advice for pink-footed geese, but not very practical. And prior to COVID, my constituency had the highest population per dentist across Norfolk and Waveney. West Norfolk was the second lowest area for dental activity actually delivered in the country, with only 65% of contracted activity carried out. And it had the highest percentage of patients who are unsuccessful when trying to get an NHS dental appointment. That was before COVID. During the pandemic, access to services has become even more severely limited, as the early results of the survey I'm carrying out in my constituency shows, with many patients unable to get treatment. And the British Dental Association have said that 20 million appointments have been lost nationally, and access to emergency dental care has also been very challenging. I've helped constituents to access the urgent dental care that was there, but the General Dental Council reported that 50% of people didn't know that it existed, which may explain why a fifth of people experienced pain or even took action into their own hands. It's crystal clear that the level of provision in North West Norfolk is simply not good enough. This is a long-running issue. I've spoken on numerous occasions to the NHS East of England Direct Commissioning Group, whose responsibility is to commission those services, to underline the need for improved local access. I certainly acknowledge there are challenges in attracting and recruiting dentists in North West Norfolk, and there have been positive developments such as the opening of the surgery at Marham, which my constituents have been using successfully. And I know the Commissioning Group are actively exploring the increased use of training places to play a part in a sustainable approach to this. But of course it's important that the significant backlog due to COVID is addressed and done so safely. And like honourable members who've spoken, I've been contacted by dentists in my constituency who are concerned at the activity levels they're being asked to deliver and question whether they'll be achievable, and I'm sure my honourable friend will address those concerns in her remarks. But what my constituents really want is a commitment to short, medium and long-term improvements so they can actually see a dentist. My dentist in Kings Lynn High Street closed in November, and the money for that should be used to recommission services locally. Prior to COVID, the NHS planned to open another practice by the summer and to issue a procurement exercise offering in perpetuity contracts, which should be more attractive to providers in the long term. Understandably, those plans are now on hold, which is disappointing for my constituents. They want a public commitment to address these issues so they know that improved provision will be coming. So I ask my honourable friend, the Minister, if she will meet with me to discuss these issues so that we can urgently address the provision that is certainly inadequate for my constituents.